and share his thoughts for 5 minutes. So, Professor, can you please share your thoughts before we move on to the questions that we have received?
Thank you very much. I am indeed thankful to the Parkinson's UAE for inviting me to speak today. Your Excellencies, members of the expert panel, ladies and gentlemen, greetings from Chennai, India. And I, on behalf of my faculty and members of the university, acknowledge this opportunity to share my experience as a Parkinson patient. I've heard a wonderful commentary by the previous panelists, and I just wonder how many more thousands of people are having similar experiences. I am a doctor trained in ear, nose, and throat specialty, and also I have trained in microsurgery of the ear and cochlear implantation. I was working as a professor and doing fairly well in my profession. I mean, it all hit me like a tsunami. I was just short of my 60th birthday, to be exact, exactly 7 years back, April of 2014, when I noticed the tremors in my left hand. Being a micro ear surgeon, I found it difficult to cope with it. The neurologist, within the first and second consultation, an eminent neurologist in my city, diagnosed me with this condition and asked me to take medication and exercise, and said that you can perform everything, but there will come a time in about 5 years or so when you will start noticing that things are not exactly what you want to do. You will find it difficult. And then I did my own little research, and I found that this was a story with many patients, and I was thoroughly disillusioned. And especially when I realized that I would probably be a person who will not be able to perform my favorite task of doing surgeries. 3 months of this depression, and then I said, let me fight it out. As a student, as a youngster, I was a sportsman and a paratrooper and a skydiver. So I said, like everything else, I have to fight it out. And then I went on and on, but the disease was progressing. And very soon I discovered, like my previous panelists have said, my signature was altering, my speech was stuttering, my gait was shuffling, and my ability to perform long surgeries was coming down. It was providence, and it was really a godsend when one of my childhood friends discovered me in this state. And he brought me to Dr. Mehta, who happened to visit my city. And that consultation, as some of you have said, really changed my life. 1.5 hours of consultation, precise. He reduced so many medications, he added a few, and told me what to do. To make things less monotonous and short, I will just read out what I wrote to Dr. Mehta 8 months after I met him. This is in October of 2019. A note to express my profound gratitude and convey sincere thanks for what you have done in controlling my Parkinson's disease. I came to you about 8 months ago after having consulted and being treated by 3 eminent neurologists. I came with no hope as my condition was worsening rapidly, even though I was taking 11 tablets round the clock. After a thorough clinical assessment, you changed my medication while questioning the rationale of many medicines that I had been prescribed earlier. and was taking regular visits. You were rational in your approach and took pains to explain everything to me and treated me like a professional colleague. Though skeptical in the beginning, I developed a deep respect for you and your expertise in this field. After 8 months of your treatment, I am a changed man, leading my life with a new vigor and confidence. My depression has nearly vanished. I am able to do many things now that I was struggling to perform earlier. That is, buttoning my shirt sleeves, wearing a necktie. I am walking with confidence and speaking with authority, courageously, all thanks to you and your team. I wish that God grants you many more years to continue your service and expertise to rescue many patients across the globe. Now, this is 2019, and today we see that we are gathered from across the globe to join hands in fighting this disease. And I still remember what I normally project at the end of my lectures, that is, never give up. And we would never give up. As the first panelist said, it is devastating when it happens to you, but if you have the courage and the willpower, and people like Dr. Ray Chowdhury and Vinod Mehta, who could actually do research and give us the hope that this is a controllable disease, and this is not something to be shy of, but to be afraid of, we can still perform. And after 7 years of this disorder in me, I am performing far better than what I used to do earlier on. We would have probably millions of people in India with a population of 1.3 billion who need help in this. So I have decided that in my university, we would do whatever research is required and partner with King's College London and try to take things forward in this part of the world. And we are definitely proactive in this field. I wish to thank one and all for giving me the opportunity, and we would hope more and more such wonders happen across the globe. Thank you very much.
Thank you so much, Professor. Now, before we move on, I would like to introduce the expert panel. Now, all the names in the expert panel, they are the